Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Good day to everyone. We are the Group 3 presenting to you a discussion on allergic rhinitis. So what is allergic rhinitis? Allergic rhinitis is a reaction of our body that is triggered by airborne allergens or inhaled allergens. Now, depending on the allergen that the person has inhaled, the type of rhinitis may occur seasonally, what we call the hay fever, or throughout the year, what we call the perennial allergic rhinitis. It can occur in all age groups, however, it is more common in young children and adolescents. Allergic rhinitis is the most common form of respiratory allergy that is assumed to be mediated by an immediate immunologic reaction or the type 1 hypersensitivity. Now, for the causes of allergic rhinitis, it is commonly triggered by the following. We have foods such as peanuts, walnuts, Brazil nuts, wheat, shellfish, soy, cow's milk, and eggs, and medications such as penicillin, sulfa medications, and aspirin, animal dander, cigarette smoke, dust mite excreta, fungal spores and molds, feather pillows, and in spring we have triggers such as tree pollens, in summer rose pollens and grass pollens, and in autumn we have weed pollen. Now all of these are common cause of allergic rhinitis. However, as I've mentioned before in the second slide, depending on the allergen that a person has inhaled, the type of allergic rhinitis may occur differently. Now these four here are common triggers for perennial allergic rhinitis, and these three here are of course common triggers for seasonal allergic rhinitis.
Okay, so now let's move on to the risk factors. So first is the genetic predisposition. Okay, so allergies are often inherited. So if a grandparent, parent, or sibling has allergies, you are likely to have them as well. And symptoms will often start showing during childhood. Plus, if you have skin allergies or asthma, you are also likely to have allergic rhinitis. And next is the exposure to a house allergen, because if you have pets, their dander may have trigger allergic rhinitis, and in addition to pet dander, there may be mold, dust, and microscopic mites that are also well-known household triggers. And next is exposure to smoke. So children who are exposed to any kind of smoke by their parents, other family member, or frequent guests are also likely to develop allergic rhinitis. And this includes secondhand smoke from cigarettes, pipes, cigars, and illicit drugs. And children who frequently inhale secondhand smoke may not only develop allergies but also incur damage to their lungs. And next is the high pollen count. So pollen is probably the most well-known allergen for people who suffer from allergic rhinitis. Tree pollen, grass pollen, and ragweed pollen are common cause of hay fever. And it is recommended that the patients with allergies regularly monitor pollen counts and restrict outdoor activities when the pollen count is high. And next is the occupational hazard. So another well-known risk factor for adult onset allergic rhinitis is occupation, and if you are exposed to harmful gases, chemicals, and air pollution due to the nature of your work, then your body may develop an allergic response to these environmental irritants. And lastly is the gender. So some studies suggest that allergic rhinitis may be more common in males during childhood, but more common in females after adolescence.
Hello everyone, I am Charlene Escalante and I will be discussing the assessment findings or the signs and symptoms as well as the nursing diagnoses that are commonly used in allergic rhinitis. So first, in seasonal allergic rhinitis, patients often experience the following. First is paroxysmal sneezing or a frequent sudden bout of sneezing. So it occurs as a reflex to clear the irritants in the nasal passages. The next one is profuse watery rhinorrhea. It is the excessive clear watery discharges from the nose. So once may makapasok na allergen sa ating katawan, the immune response triggers the release of histamines, which causes the blood vessels in the nasal lining to swell and leak fluid. So it will then result to a runny or watery nose or yung sipon na lumalabas sa ating ilong. Next is the nasal obstruction or congestion. In easier terms, it is the difficulty of breathing through the nose due to the blockage na nangyayari dahil sa swelling ng ating nasal tissues and due to the increased mucus production. The fourth one is the pruritus of the nose and eyes. So pruritus is the medical term of itching sensation that is present in the nose and eyes, which are a common response to histamine release. We also have pale cyanotic and edematous nasal mucosa or swollen, pale or bluish nasal lining due to reduced blood flow as a result of allergic inflammation. Then, red and edematous eyelids and conjunctivae. So, similar to the nasal mucosa, allergens can cause inflammation of the eyelids and conjunctiva, resulting in redness and swelling. The next one is excessive lacrimation. So there is an overproduction of tears that occurs as a protective mechanism to wash away allergens from the eyes. So, di ba our eyes is one of the, what do you call this one? The portal of entry for some allergens. So, if ever na may allergens na ma-trap doon sa eyes, nagpo-produce ito ng tears in order to wash out yung allergens na nasa eyes natin. The next one is headache or sinus pain. It is due to the pressure and congestion in the nasal passages and sinuses. Then, lastly is the itching in the throat and malaise. So, malaise is the general feeling of discomfort. So, since there is too much mucus from the inflamed nasal passages, there is a possibility that it will flow down to the back of the throat, which can cause itchiness and discomfort. For the perennial allergic rhinitis, patients may experience the following. First is the chronic nasal obstruction. So from the word chronic, it is a long-term nasal blockage that can occur for 6 months and above. This happens when the tissues in the nasal passages remain inflamed and swollen for an extended duration, making it difficult for the air to flow freely through the nose. This obstruction can extend to eustachian tube obstruction, which can also lead to ear problems, most especially in children. So the eustachian tubes are small tubes that connect the middle ear to the back of the throat. They play a crucial role in regulating air pressure in the middle ear and also in draining fluids from the ear. In children, chronic nasal congestion can sometimes extend to affect the eustachian tubes, causing them to become obstructed. When the eustachian tubes becomes blocked, it can lead to issues such as ear infection and discomfort in the ears. So the connection between nasal obstruction and eustachian tube problems is particularly relevant in children because their eustachian tubes are shorter and more horizontal than in adults. So this makes them more susceptible to blockages. So the obstruction in eustachian tubes are hindi siya common sa adult, mostly sa children lang. And in both types of allergic rhinitis, dark circles may appear under the patient's eyes. So dark circles under the eyes of the patients are commonly referred to as allergic shiners and are often caused by venous congestion in the maxillary sinuses. This congestion can be a result of chronic nasal congestion and inflammation associated with allergic rhinitis. So when the nasal passages are congested, blood vessels in the area become dilated, leading to increased blood flow to the skin under the eyes. The increased blood flow can give the skin a darker appearance, resulting to the dark circles or shiners. So remember that the severity of the signs and symptoms may vary from season to season and from year to year. So also, the intensity of the symptoms can change with the seasons and over the years.
Assalamualaikum and good day. Hi, I am Somayyah K Ditucalan and my part is to discuss with you the diagnostic evaluation test of allergic rhinitis. So first we have here the IgE test. So when we say IgE test, it is used to measure the total amount of IgE antibodies in your blood. So a specific IgE test measure how much IgE your body makes in response to a single allergen. So IgE level greater than 140 IU per ml and eosinophil counts greater than 80 cells per ml suggests presence of allergic condition. So next we have also here the RAS test. So when we say RAS test or a radioallergosorbent test, it is a way of tasting a person's blood to see if they have any allergies. So this test check their blood for specific IgE antibodies to find out what substances they may be allergic to. And then next we have also the skin test, which is a patch and and then next we have also here the skin test. So when we say skin and then next we have also here the skin test. So skin test, we have here the patch test and scratch or prick test. So when we say patch test, it is usually performed in the back. Allergens are applied to patches and stalk skin. And then next we have the scratch or prick test. So a drop of allergen is placed on the skin, usually in the forearm and prick into the skin. So evidence of allergy includes raised bumps and also itchy red skin.
So now let's talk about the pathophysiology of allergic rhinitis. So during the primary exposure to an allergen, the T cells recognize the foreign allergens and release chemicals that instruct the B cells to produce specific antibodies called the IgE. Now these IgE antibodies attach themselves to mast cells. These mast cells with attached IgE can remain in the body for years, ready to react when they encounter the same allergen again. Now, if the allergen enters the body the second time, it will come in contact with the antibodies attached to the mast cells. Now, this action stimulates the mast cells to release a chemical called the histamine. Histamine is the major mediator of allergic reactions in the nasal mucosa. The release of histamine will initiate a response that causes tightening of the smooth muscles in the airways, dilation of small blood vessels, increased mucus secretion in the nasal cavity and airways, and itching. Now, these reactions, if left untreated, can lead to complications such as allergic asthma, chronic nasal obstruction, chronic otitis media with hearing loss, anosmia, and orofacial dental deformities in children.
Based on the assessment data, these are the major nursing diagnoses that can be used for allergic rhinitis. First is the ineffective airway clearance related to the obstruction or presence of thickened secretions. So allergic rhinitis often leads to nasal congestion, which can also obstruct the airway and make it difficult for the patient to breathe through their nose. And in response to allergen exposure, the nasal passages may produce excessive mucus, which can also become thickened and further obstruct the airway. So the combination of nasal congestion and thickened secretions can impede the effective clearance of airway obstructions, leading to discomfort and difficulty in breathing. The next one is activity intolerance related to imbalance of supply and oxygen demand. So due to the nasal congestion and reduced airflow caused by allergic rhinitis, patients may experience decreased oxygen intake during physical activities. The increased effort required to breathe through a partially blocked nose can lead to an imbalance between the body's oxygen demand and supply. And as a result, the patient may feel fatigue, shortness of breath, and they may be unable to engage in physical activities compared to when they are not experiencing allergic rhinitis symptoms. And the last one is disturbed sleep pattern related to obstruction of the nose. Allergic rhinitis often worsens at night, leading to increased nasal congestion and difficulty breathing through the nose during sleep. So the obstruction of the nasal passages can disrupt the patient's sleep pattern, causing frequent awakenings or feeling of restlessness. This can result to daytime drowsiness, fatigue, and decreased overall well-being of the patient. So that's all for my part. Thank you so much and have a great day ahead.
So now we have here the therapeutic management for a patient with allergic rhinitis. So first we have the medical management. So we have here the allergen avoidance. So a patient with allergic rhinitis should identify and avoid allergens that trigger his or her symptoms. So common allergens include pollens, dust mites, pet dunders, and molds. And then next is to use allergen-proof covers on pillows and mattresses. And then keep windows closed during high pollen seasons. And then use air purifier with HEPA filters to reduce indoors allergens. And then wash bedding and curtains regularly in hot water. So next we have here the symptoms management. So over-the-counter decongestant nasal sprays and eye drops can provide temporary relief, but they should not be used for an extended period due to potential side effect. And then we have the lifestyle modifications, which is we should avoid smoking and exposure to secondhand smoke, as this can worsen symptoms. So maintaining good indoor air quality can also help. So next we have here the nursing management. So nursing management of allergic rhinitis involves providing support, education, and assistance to individuals with allergies to help them manage their condition effectively. So here are some nursing interventions and responsibilities related to allergic rhinitis. So first we have the assessment. So conduct a thorough assessment of the patient's medical history, including allergy triggers, symptoms, severity, and previous treatment. And also we have to perform a physical examination, focusing on the nasal passages, throat, and ears. And then document the patient's symptoms, including sneezing, nasal congestion, runny nose, and itchy or watery eyes. So next we have the education. So educate the patient about allergen avoidance strategies, such as minimizing exposure to trigger like pollens, dust mites, and pet dunders, which I've mentioned earlier. And then teach proper techniques for saline nasal irrigation. And then explain the importance of adhering to prescribed medications and their potential side effects. And also, we have to discuss lifestyle modification, including smoking, cessation, and maintaining a clean indoor environment.
Good day everyone, my name is Louie Jay M from MSU Basin 3 and today I am going to discuss the drug therapy. So we have here the antihistamines. So these are medications that help relieve allergy symptoms like sneezing, itching, and runny nose. They work by blocking histamines, which are chemicals your body releases during an allergic reaction. You can find them in oral form such as pills that are available over the counter, OTC, or by prescription. Common examples include loratadine, cetirizine, and fexofenadine. Next, we are going to tackle the nasal antihistamines. So these are similar to regular antihistamines but in a nasal spray form. They are usually available by prescription and include options like azilastine. Next, we are going to tackle the decongestants. Decongestants help relieve stuffy or congested noses. They work by narrowing blood vessels in the nasal passages, reducing swelling. You can find them in oral form as OTC medications like the pseudoephedrine or Sudafed. There are also nasal decongestant sprays available over the counter like the oxymetazoline or Afrin. Next, we're going to tackle the intranasal corticosteroids. So these are prescription nasal sprays that help reduce inflammation and relieve allergy symptoms in the nose. Examples include fluticasone or Flonase, We have also the budesonide or rhinocort, then mometasone or Nasonex. So next we are going to tackle the leukotriene receptor antagonist. So these are prescription medications that help control allergic reaction by blocking certain chemicals in the body. We have the example here, montelukast or Singulair. For immunotherapy, for severe or persistent allergies, immunotherapy might be recommended. This involves allergy shots or sublingual tablets. Over time, they can help your body become less sensitive to allergens, reducing symptoms. Then we're going to tackle the eye drops. Eye drops can help relieve itchy, red, and watery eyes due to allergies. Antihistamine eye drops are available in both OTC and prescription forms. Examples include the ketotifen or Zadator and olopatadine or Patanol. That's all. Thank you for listening.
Okay, so next is the turbinoplasty. So this procedure involves reducing the size of turbinates, which are structures inside the nose that help to humidify and filter air. And enlarged turbinates can contribute to nasal congestion and snoring. And the next surgical therapy is the septoplasty, and this surgery corrects a deviated septum which can block nasal airflow and cause breathing difficulties. And next is the turbinectomy. So this procedure involves removing a portion of turbinates to improve airflow and reduce congestion. And lastly is the endoscopic sinus surgery, and this surgery is used to treat chronic sinusitis, and which may be a contributing factor to allergic rhinitis symptoms. So I think that is all, and thank you for watching and listening.